Hello, everyone, and welcome to Tribe Talks. This is where we connect with you, members of the Mindvalley community that are up to amazing things. This is the show where we connect with you to share your story, to share the work that you're doing, and to hear what amazing stories of inspiration are going on within our community. So welcome. Tonight, we are joined by Dr. Priyanka Halli. She's a psychologist working in Vancouver, Canada. She graduated from Harvard with a master's of public health. And after school, she decided to move to India and start an NGO that supported girls that were rescued from human trafficking. And after that, she came back to Canada, where she now works in an emergency room, and she also works with Indigenous communities in Canada. And she's passionate about the intersection between psychiatry and spirituality. Welcome to the call, Dr. Priyanka Halli.
Thank you so much, Ezra. It feels like it's been almost a coming home for me coming to this call, because A-Fest and Mindvalley has been such a big part of my journey. So I'm excited to share this all with you, and doing it on Tribe Talks, it just means a lot to me, because this tribe has really helped me get to where I am today.
Thank you. Yeah, I've been to A-Fest once, and it was definitely a life-changing experience for me. I actually fell in love at A-Fest. That's a whole nother story. But I would love, I know a little bit about your story. I would love for you to share with the audience how A-Fest actually changed your trajectory that you originally had planned after you got out of school.
Yeah, I don't know if it's like been the same thing for you, Ezra, or for the community we have online today. But I found, unfortunately, that a lot of my kind of spiritual awakening came from hardship. I really wish that we could just be really happy and then have a spiritual awakening. But I think for a lot of us, it has to come from hardship. So that for me, that was in about 2012. I was in my second year of psychiatry residency. I had finished med school and was just feeling really burnt out. I was also at that time being bullied by a staff I was working with, and the relationship that I thought was going to end in marriage ended up crumbling, and we broke up. So I also wish that, immediately after all of that difficulty, I had a spiritual awakening. But to be very honest, initially I just tried to numb the feelings, socialize more, travel more, escape more. But eventually, after a lot of other things, I did end up at A-Fest. And that story is a bit bizarre about how I actually ended up there. Would you like me to share that?
Yes, totally.
Okay. It's a bit
We love bizarre stories.
Yeah, it's a bit embarrassing as well. I think my parents might join today's call. They don't actually know the story, so heard here first. So I actually, I guess in the context of that breakup, decided I wanted to kind of leave Vancouver for a bit, and I was in the middle of my program, so I thought the best way was to apply to another program to get out of Vancouver, honestly. And so, when you're down from a breakup, your self-esteem's not great. I decided to apply to Harvard, maybe for an ego boost. So I ended up getting in there, and I went there. And I'll talk a little bit about that, because there was things in that program that were very important to me. It was a public health program, so it was the first time I started seeing medicine less from a disorder perspective and more from a how do we prevent this from happening, instead of just treating people that already have a disease. So yeah, that was very important to me. But the way I got to A-Fest was actually towards the end of my time in Boston, probably about 3 weeks before I was supposed to leave. I met this guy. And just to give you some background, I grew up in a very spiritual home. The foundation was Hinduism, but always on our cassette player would be like Wayne Dyer and Brian Weiss, and it was a very spiritual place to grow up. But I think as I went into my teenage years and I went into medicine, I kind of stepped back from a lot of that. And by the time I was in 2012, I didn't really have a lot of spiritual practices. So I meet this guy in Boston, and he actually brings me back to Hinduism. He was actually from Mexico, but he was really into Hinduism. And it was a little bit like echoes from my childhood around that time. And there was just something, I was so drawn to this guy, but I was actually ending my time in Boston. So we departed. I went back to Vancouver. He went to Mexico, and he just kept being on my mind. And I kept in touch with him. And eventually I was like, I just need to see what this is about. So I said, like, he had been offering, and I said I would come visit him in Mexico. And so I booked my flight, everything was ready. I was super excited. It was kind of decreasing some of my burnout because I was like, oh, I have something to look forward to. And probably 2 weeks before I was supposed to go to Mexico, I'm going to be generous, maybe it was 3 weeks. He calls me and says, I'm really sorry, but I've gotten this invite to this invite only, seminar or personal development conference called Awesomeness Fest. And it's exactly in the time that you're coming to Mexico. And I feel so horrible, but let me send you the link. I just don't know how I can say no to it. And I would take you if I can, but it's invite only. So I just feel really bad about this. And I was devastated. I was not impressed, but I kind of brushed it off and said, okay, let me see if I can cancel my flights. And so he sent me the link, and I just was at home in Vancouver feeling pretty low. And I remember that night just for the first time hearing of Mindvalley and just exploring probably till like 4 a.m, all of your content, hearing Vishen's voice for the first time, doing the 6-phase meditation for the first time, and just feeling so drawn to it and just feeling like I need to be here. When I was going through all of that research, I did see that a friend of mine, actually not even a friend of mine, my best friend's ex-boyfriend had liked Awesomeness Fest and had liked Mindvalley. So I just randomly reached out to him and said, like, how do you know about them? Like, tell me about it. And he was like, actually, my sister works for them. And so through that process, that very random, bizarre process, I actually ended up applying to attend Awesomeness Fest, got an interview, and like a stalker, as my husband says, ended up at A-Fest. I'd love to talk to you a little bit about this more, but A-Fest was such a life-changing experience in my life. So yeah, it's a little bit of an embarrassing story, but I think I was drawn to him because I was meant to come to A-Fest.
Mm. So tell me how did the trajectory of your life change after A-Fest?
So
what realizations or insights did you have when you were there?
So in a lot of ways, but I'll share maybe 2 or 3 that really stuck with me. And it's interesting with A-Fest, sometimes you think, it's going to be the speakers on stage that are going to change you. But for me personally, it was actually at the parties with the tribe members, like we're talking to today, that really changed my life. And yeah, you married one or you're with one, so you fell in love with one. One of the members really early on in my A-Fest journey, kind of very honestly and with lots of love, came up to me and said, I feel like we're not able to get to know you because there's a lot of filtration. And for me, that was something I never recognized that people saw in me, but he was completely right. Every time I talked, I had already kind of filtered it in my mind, thought about what I was going to say, and then spoke. So it was very much coming from my mind instead of my heart. And so at A-Fest, I would say was the first time I learned how to speak from my heart. Still, I struggle with that today. And even now I'm like, trying to think of what I'm going to say, but I'm much better at it because I had that realization. Another thing that happened at A-Fest was I recognized that to move on in life in terms of, finding a partner, reaching a level of contentment, I had to really repair my primary relationships. And for me, that was with my mom. So not that our relationship was bad at that time. It was more that, maybe some resentment because she worked a lot when I was a kid. But our relationship had gotten into this pattern of she'd call me almost every day, and our talks would be like, "How are you doing? Good. What are you doing? Nothing. What did you eat? Mom, I have to go right now. I'll talk to you later." Like, we had no meaningful conversations. And I remember coming back after A-Fest, after having that realization, and I had actually lost my phone in Mexico. And so I actually had to go to a friend's house to use their phone to call my mom, but they weren't home. So I went to their neighbor's house. Like, I was so desperate to talk to my mom after that. And we really have fixed our relationship to the point that now we have a lot more meaningful relationships. But I would say the number one thing from A-Fest that really has stayed with me was becoming closer to my intuition and to my inner voice. So when I came back to Vancouver, I wasn't able to lead the same life again. I wasn't able to be complacent and just continue with the steps that are expected in medicine and in a career like this. I had to really realize I have to change things.
Yeah, I think that's probably a regular occurrence for people that go through something similar, is when they have this breakthrough. I guess maybe it's like finally, I know it was for me, it was finally realizing that I haven't been listening to that intuition for my whole life, or I didn't know it was there. And that's what was missing. And it's somehow connecting back with that to get you back on the right path. At least I had a similar experience when I went through kind of my breakthrough. I was going so far along one journey that I didn't even know I wanted or anything. And it got me so far away from who I was.
Yeah, I had the same experience. It took me a while to actually realize what my inner voice was saying. And it was actually through some tribe members that I got there, if you want me to share that part of the journey.
Yeah, sure.
So I came back to Vancouver again, realizing I needed something different, but also continuing with the path till I figured out what it was. I actually ended up going to 3 A-Fests in total. By the end of my last year of residency, so the time when I had to figure out what I was going to do, I kept going to these job interviews and I just felt like this is not what I'm supposed to do. And I didn't know what an alternative was going to be. So actually, one of the tribe members in Vancouver invited me to this conference called Man Enough. And in it, the speaker named Philip McKernan, I think he's actually done some work with Mindvalley. He took us through this meditation, and the seminar was on purpose. And in the meditation, he had us kind of close our eyes and think back through our childhood of all those moments that really imprinted themselves on your soul. He called it snapshots of your soul. And what he said was that those moments actually would be maybe a clue of what your purpose is supposed to be. So when I did this exercise and I closed my eyes, all of the moments that had stuck with me had something to do with India. And so I came out of this meditation, tears flowing, finally able to listen to my inner voice that told me that I needed to go to India. So it's easy to go to one of those conferences and really know that's what you're supposed to do. But then to tell your family or friends, like, everybody thought I was insane. I had a lot of student debt, right? I had been in school for 12, 15 years. Finally, I was able to work. I didn't know people in India. I was single. My parents were terrified for me. And so it was actually a really hard journey for me to actually get to India, to the point that my parents actually convinced me to go to another job interview in Winnipeg, where they live. And in this job interview, I just had to be honest. And I told this person, the head of psychiatry of Winnipeg, I told him, to be honest, like, the universe is calling me to India. And that's not something you usually say in a job interview for psychiatry. But he was actually super nice about it. And he actually told me that his brother-in-law had had a similar experience a number of years ago, actually 15, 18 years ago, and he had been living in Mumbai. So he said, okay, come back for this job whenever you want. But when you're in Mumbai, if you want to get in touch with my brother-in-law, he loves taking Canadians around. He's been through the whole process. It can be very daunting, so he'll take care of you. And when I went to India, I knew 3 people. 2 of them were AFesters, and the third one was this person who I didn't know, but I just reached out to. That person is now my husband. So there was so much serendipity that happened around that time that got me to India, to the point that I knew that was where I was supposed to be.
Amazing, amazing that you followed that. I know it's not an easy choice. So tell us about the work that you're doing now, and how you're integrating more Eastern philosophy, spirituality, and personal growth into psychiatry. I know, probably, at least from my perspective, it seems like psychiatry and also mental health, it's kind of a very traditional, it's very traditional, and maybe they're not always using some of the new practices that we learn at Mindvalley and stuff, but I would love to hear, and the audience would love to hear, how you're blending that and actually moving the industry forward to a more holistic approach of mental health.
Yeah, so a lot of where I am right now came from my time in India. So I'm just going to share a little bit about that. First of all, I think it's a personal journey. So when I went to India, and the first year I was there, I was getting urinary tract infection or other kind of infections almost every month. And initially I went to, the regular doctor, and I was put on antibiotics. But after maybe 5 or 6 courses of that, I had learned enough about antibiotics that I knew that wasn't good for my system. I also ended up developing an autoimmune disease in India called Graves' disease. So I had a lot of health problems in India. And again, like I think you heard earlier, when these difficulties come into your life, there's usually a bigger purpose, a bigger learning. So I had a bunch of difficulties in India, and all of them now I see as learnings. So my health difficulties in India, it actually was the way that I started exploring other modalities of healing. So I realized I couldn't do another course of antibiotics. So let me try Ayurveda. Let me try homeopathy. Let me try acupuncture. Let me try, spirituality and meditation. And through those modalities, I was actually able to heal myself. So I think only through that process of healing myself was I more comfortable with incorporating these modalities into my practice. A few other things that happened in India that really affect my practice. And again, at the time that I was going through it, I thought it was like a bit of a disaster. But the Indian government actually never approved my medical license in India. They kind of said, you're, in Canada, you don't approve our license. Why should we approve yours? Which was fair. But what that meant was that I could not prescribe a medication for the 3 years that I lived in India. And I still wanted to work. So I worked more from a public health standpoint. So creating programs that might actually prevent mental health disorders, as well as doing therapy. So without the crutch of medication, I had to really get better at doing other modalities of treatment. And then finally, I just want to share this with your audience. I don't know if they know this, but India has over a billion, 1.3 billion people, yet their psychiatry specialist groups, so I would say psychiatrists, social workers, nurses, all of that combined is 7,000 people. So just
Oh my God.
just to give you an idea, if they had the same kind of ratio as like the UK has for like psychiatrist to patient, like what's your best guess of how many they would need in India?
Millions, right? Millions.
So not so bad. It's 150,000,
Okay.
but because UK still has a problem with getting those kind of services, but we only had 7,000. So the treatment gap in India right now is 90%. And what people in India are realizing is that it's not about training more specialists. So the US has a lot of specialists, but their treatment gap is still 50%. And out of, I think, a lack of resources, they actually have been very innovative. And so one thing India and other places like Africa have shown is that you actually don't need a specialist to treat mental health for the wide majority of cases. And so some
Wow.
of the work in India was actually training lay counselors. So that's people that have a grade 12 education. We take them through like a 6-week program. And then at the end of that, they were doing much better than antidepressants in terms of leading to remission of depression. So, there's multiple studies about this. And if you combine all the studies, the effect size of a lay counselor, so someone with no specialization in this, is 0.49. The effect size of an antidepressant is 0.3. So they were doing way better than an antidepressant at being able to help people through depression. And for me, initially it was a bit of a shock because, I've done all the school and like, how can someone else treat depression better than I can? But when you actually look at it in psychology, there's this thing called the common factors model that says it doesn't actually matter what kind of therapy you do. It doesn't actually matter how many degrees your therapists have. The ability to form a relationship with your patient is the biggest indicator that that person is going to get better. So if we could just find the people who had graduated grade 12 and were the most emotionally intelligent and train them in like a 6-week program, they were going to be able to get people much better from mental illness in terms of listening, reflective listening, validation. All of those skills that we taught in 6 weeks is enough. So that really inspired me and has actually influenced my work right now in terms of really creating a mental health workforce. Because I honestly feel, Ezra, we are in a mental health epidemic right now, especially after the pandemic. Our numbers have gone up. All the psychiatrists I work with are burnt out. So we really need to have more people trained in how to provide some emotional skills.
And I think this is a fantastic idea, but is the current institution of mental health, is it open to these kind of lay counselors?
So it's a very good question. I think a lot of the developing countries are much more open to it, but we are becoming more open to it here in Canada and the US. So we're doing more studies here rather than having it implemented, but I'm part of a big study right now that's actually training university students to become peer counselors. And so we have funding for that. It's in a number of universities across Canada. So they are letting us study it. And I think once we show the evidence for it, it might become more mainstream.
Yeah, I definitely hope so. More boots on the ground, so to speak, would definitely help everyone. So this is fascinating. So there's actual research that says someone caring about you and your condition is more effective than antidepressants. Did I get that right?
Yes, that's research published in the biggest journals in the world is saying that. Yeah. But unfortunately, all of those studies were mostly done in developing countries. So we need to do more here in North America, which I'm hoping to be part of.
It makes sense. And it also might, it kind of piggybacks on to why one of the factors with the pandemic and everything, people are so separated from one another now. And it's even harder to have just the base connections we had before the pandemic. So with COVID and everything that's going on in the world, what type of mental health issues are on the rise most?
So it's been interesting with COVID, actually. Some people that were struggling with mental health for a long time before, maybe people that had more anxiety, more OCD, they're actually in some ways doing a bit better because they're allowed to stay home right now. That's normalized. So it's been interesting, but I think overall we are seeing a lot more people that have anxiety, depression, not sleeping than we did before. So this is why I'm very passionate about kind of the lay counselor model. Another thing that I'm very passionate about is changing the way we see mental health disorders into being more strength-based. So what I mean by that is the way I think psychiatry practices right now, and not all psychiatrists, I'm very lucky to work with people that don't think like this, but it's very disorder based. Like there's something wrong with you that we need to fix. But a lot of the conditions that we actually see when there's actually a chemical imbalance, it actually brings strengths in addition to the deficits. So let me just give you an example. Kids with ADHD, sometimes they're made to feel like they're lesser than, something's wrong with them. But I'm very cognizant every time I talk to a parent to let them know that with that difference in the way they think, in terms of having difficulties with attention, there are also people that are going to be much more skilled athletically and physically. So a lot of Olympians actually have ADHD, like Michael Phelps and Simone
Oh,
Biles.
wow.
Like a lot of them have that. And our studies are actually showing, there's a study actually that shows that if you're going on a treadmill, if you have ADHD and you're learning on a treadmill, you actually can learn in the same way that someone without ADHD can. Our systems aren't just built for that right now. We don't have treadmills in every classroom. So I think like stressing the strengths that come with these kind of mental health difficulties, in addition to the deficits, makes it a more strength-based approach. I'll give you just one more example. Bipolar, something that can cause a lot of emotional dysregulation in a person's life. We also know that when your brain works in that way, you're a lot more creative. So some of our biggest artists, like Mariah Carey, Mel Gibson, they have bipolar and they have brains that are going to be more creative than the rest of us. So I just think that we need to, can we use your strengths to also lead your treatment?
A lot of that too in my own research, that there are so many other benefits to some of these quote conditions, excelling in sports or creativity or bringing their own truth out into the world in a different way. So that's great. I think one thing is we need to destigmatize it as well, right?
Exactly. Yeah. I remember like a professor of mine always used to tell me if he moved into a new neighborhood, he would want to meet all the people with anxiety first because they make the best friends. They're so worried about, how they're presenting or what you think of them, that they're so sensitive to your needs. So yeah, I really am honored to work with the group of people I work with and the patients I see, because I learn so much. I think one of the groups of patients that I really learned the most from was the group I worked with in India, which was girls rescued from trafficking, which can seem very daunting and overwhelming, and they had been through so much trauma. But it was an age group between 12 and 18, and the amount of resilience I saw in these girls just kind of made me have so much faith in our young population in terms of changing the world. And I think that's another area where I'm very passionate about, is that if we teach emotional regulation skills early to not people that have mental health disorders, but to everyone, we could actually be preventing a lot of what we're seeing in today's society. If people knew how to, control their anxiety at 12, instead of learning geometry or in addition to geometry, that would be such a more important skill for them later in life than geometry would ever be. So that's another kind of area that I'm very passionate about, is teaching resilience skills to especially younger people while their brains are more neuroplastic.
Yeah, I think resilience and emotional health is so important, something to learn young. I had my Kensho moment when I was 26, but I suffered for all of those years before because I didn't know what to do with my emotions, or even that I should talk about them, or that they were okay to have them, because we were never taught, right? There's no school, not even extracurricular, no programs. I didn't have access to the internet back then. And so I would love to see this implemented more as part of curriculum, is just these kind of basic emotional health classes for kids throughout school.
Exactly. There's a type of therapy called dialectical behavioral therapy that for some reason right now we just give to the most suicidal people. And it tends to be one that gives you coping skills. When I learned that therapy, I was like, why didn't I learn this when I was a kid? Like, I'm not suicidal, but these coping skills could help everyone. And one big part of that is mindfulness. Another part is interpersonal effectiveness. Another part is emotional regulation and distress tolerance. That's something universally applicable to all of us, no matter whether we have suicidal thoughts or not. So I think really we need to destigmatize some of these therapies so that anybody feels comfortable receiving it and being a part of it and teaching it in schools. So yeah, sorry to be on my soapbox, but these are things that really get me passionate.
No, I love it. So before we get into Q&A with the audience, by the way, everyone, we're going to be bringing you on live to ask Priyanka questions. So there's a Q&A box at the bottom of your screen. You can put that in there. You can also upvote other questions that you see that you would love to see Priyanka answer. But before we break into that, can you tell us what are some of the few things that we can do, like all of us that can do, to better improve or maintain our mental health, whether we're going through COVID or not? Like, what are these practices that you found personally and also have been effective in your practice with your patients and your clients, that really help even before you get into like needing drug therapy or anything like that?
So I know when we initially talked, Ezra, this is actually what I had wanted to talk about, because these are the practices that I'm so passionate about. And you were kind of like, you're kind of preaching to the choir if you're telling Mindvalley people to do more meditation. But yeah, this is, I have a page, Dr. Halli, on Instagram, where all I talk about are these practices that help me, help my patients, but also have a lot of scientific evidence to them. So to just give you an example, there's a meditation called the Satnam meditation. And if you do it, it's been shown to prevent Alzheimer's. But you don't see a lot of doctors talking about doing a meditation to prevent Alzheimer's. For me personally, my morning routine has been the biggest thing. I think that's, in terms of a practice, been very helpful for me. This is something I recommend everybody spend some time thinking about. Again, I know I'm preaching to the choir because a lot of these techniques I got from Mindvalley. But right now I keep all of my devices outside of my bedroom. I start with reading a little bit of a spiritual book. Right now I'm doing the surrender experiment, mostly because if I start with meditation, I end up falling asleep. So I get my mind a little bit awake with the spiritual book, and then I do a meditation. And then now recently I've also been ending off with some journaling. So all of these steps have actually scientific evidence. And this is something that, I love so much. And I'm mostly sharing it with my more skeptical colleagues. So I talk about the evidence base behind all of that. If there are any kind of practitioners of mental health here, one thing that's really changed my practice has been praying for my patients. I work in an emergency department. Wow. Yeah, I work in an emergency department. So often I have people come to me who are suicidal, who don't want to stay in hospital. And so they go, and I'm worried about them. And one way that actually, has prevented kind of some negative outcomes, I think, touch wood, has been just praying for them. And there was a big study about this where, this was a Japanese study, but a group of women who had struggled with infertility, half the group were prayed for, half the group weren't. And the group that was prayed for had significantly higher fertility rates. So this is not just stuff I'm doing because, it helps me and my anxiety. It's stuff that's evidence-based. And it was interesting the other day, I was talking to my colleague who works in the emergency department with me, and she was like really worried about a patient she had discharged. And I told her, like, I was kind of, a bit sheepish, like, this is what I do for my patients is I actually pray for them. And she was like, oh my God, I do that too. So I think a lot of us are doing it. It's just stuff we need to talk about more.
Okay, so meditation, journaling, reading, definitely. I would love to ask you, what is the actual mechanism behind journaling and why it's so effective? So many people talk about it, but what's actually happening
Yeah, so with journaling, it's actually a way to process some of your emotion, but also to become more in touch with your subconscious. So for me personally, it was a bit of a struggle to start off with it. And a lot of my initial practices, especially in India, started with the foundation of yoga. And so one thing that I actually find useful is doing some hip openers first, because we store a lot of emotion in our hips. And I personally have very stiff hips. So doing a hip opener and then journaling and seeing kind of like a stream of consciousness, whatever comes up for you. And it has actually been amazing, Ezra, about all the unconscious limiting beliefs, subconscious beliefs that took me, years of therapy to reach. I get to that a lot easier through journaling. One thing to just know about journaling, in terms of science of it, they don't recommend talking about a trauma over and over in journaling. That actually can make journaling a bit harmful. But other than that, I think it is actually a place for you to heal yourself and see what comes up for you. I can just kind of anecdotally tell you for this seminar today, I was having a lot of anxiety. And so I just sat down with my journal and wrote down maybe all the limiting beliefs I had about not being a public speaker. I went into psychiatry because I wanted to ask questions and more listen. So this is out of my comfort zone. But just writing down all my limiting beliefs through journaling actually helped me kind of discover what was going on in my subconscious that was making me so anxious.
Well, I think the journaling helped a lot then because you're doing great.
Thank you.
Is there anything else you would like to touch on before we jump into some of these fantastic questions for you?
I guess I'll talk about the taboo topic of medications, or the elephant in the room.
Yes, please.
Because yes, I have my medical license now and I work in Canada now. So I am prescribing medications. And I think there is a place for it, to be honest. I think that there are times when a depression can become so overwhelming that you can't get out of bed. You can't go do your meditation. You can't go see your healer. You can't do your Ayurvedic meditations and medications. And so at that time, a medication can be very helpful. I tell the same thing to people that maybe don't have spiritual beliefs, that you can't get to therapy to do other things like cognitive behavioral therapy or DBT unless you can get out of bed. And sometimes a medication can help with that. I would also say for things like schizophrenia and bipolar, I am a bit more open to medications because the evidence is just higher. To be honest, like antidepressants, the evidence for that is not great. It's not much more than placebo. But if you have a disease like schizophrenia or bipolar, then medications tend to help a bit more. So I think there's a place for it, but definitely doing all of these other practices would be my go-to. And then when things are really struggling, I don't think there should be stigma about it, right? We don't stigmatize a Mindvalley population about taking a hypertension medication or a diabetes medication, yet we do it about, antidepressants or a psychiatric medication. I remember, at A-Fest, whenever I said I was a psychiatrist, people took a bit of an internal step back, right? It's a bit taboo in this community. But I think, there's no dualities. There's no good or bad in the way, your consciousness thinks of things. There's times when things are useful and times when it's not. So just being conscious of that.
Yeah, I definitely agree with you. I thought differently before. After I had gotten off medications years ago, I was like, no medications ever. They shouldn't be used. But when I started coaching and I started working with people with depression and other mental health issues, I did finally understand there's a time and a place for everything. that we shouldn't be over prescribing, but we should keep everything on the table because we're looking for a solution, right? We don't want to be ideological about it. So, and sometimes the medication is required, whether it's temporary or a little bit long-term, to find that solution. So I agree with you there.
Exactly. But yeah, I
Awesome.
want to hear the questions. Let's do it.
Yes. Let's see. I would love to, let's see if Jennifer Heath is here. She's got a great one about teens and social anxiety. Jennifer, I'm going to bring you onto the call as a panelist. You can turn on your microphone and your camera. And welcome to the call.
Okay.
Hi, Jennifer.
Hello, good morning. I didn't realize mine. Hi. My question is, I'm actually a teacher. I'm in California. I'm a teacher at a continuation school, so mostly geared towards 11th and 12th graders. And in California, we've been pretty much not at school for basically a year. And I have a lot of students who already had a lot of anxiety, and social anxiety, I've noticed, has really gone through the roof. And I'm just like trying to figure out in the next couple of weeks, we should be back at school. How can I help them move through their social anxiety? I think it's going to be big. To how can I help them reconnect socially and with masks on and everything? And so that was my question. Thank you.
Thank you so much, Jennifer, for the work you do. I think all of us have really seen the impact and valued our teachers so much more. And I think you're completely right in terms of being worried about this. I know in Canada, where we already have gone back to school, we're seeing tons more teens coming in, with depression and suicidality and more anxiety. Because it's been a really hard year for kids, right? Like if you
Absolutely.
think, yeah, like the younger kids, they kind of don't know better, so it's okay. And then for us adults, we're kind of used to things being a little bit chaotic. But for
yeah,
these,
and there's been an invisibility with it too, because I'm doing Zoom, but there's no expectation. Like my district doesn't make them turn on their screen, so essentially they're being invisible to each other as well throughout the whole year, and that's on top of the anxiety.
yeah, exactly. So in terms of dealing with social anxiety, but actually any anxiety, our go-to is always going to be gradual exposure. So the way to deal with anxiety is to face it. But in terms of the exposure to it, we would really recommend doing it in a very stepwise way. So you can maybe online, there'll be Google sheets of like how to do exposure for social anxiety, but it starts with very small things, like maybe just like texting, and then maybe doing a FaceTime, and then maybe going outside on your porch, and then maybe going to, and you have to get really good and masterful at each part of these before you move on to the next step. And so then maybe it's going for a coffee. And then maybe after that, it's going to just come at recess or whatever part of the school day they feel most comfortable with. But if that's kind of the best evidence we have for how to deal with anxiety, is to do gradual exposure and then to reward, whether it's, praise or even some external reward for every step that you're able to overcome. But this is hard. And as a teacher, it's overwhelming to be able to do this for each student of yours. But I think you're recognizing that this is an issue is very helpful, because I think sometimes teachers, and I don't mean to be critical or anything, but I think even parents, actually, I see more parents doing it that say, my child should be going to school and, it's all or nothing. And they're a bad kid if they don't go to school. But we have to understand this year was, out of the ordinary for these kids, and they're developmentally at a time where they're making their ideas of whether the world is a safe place or not. So it's a time we have to be very sensitive about for this age group.
Thank you so much.
Thank you, Jennifer. And thanks for your work.
Thank you.
Yes, thanks so much, Jennifer. All right, next up is Hannah. Let's see, Hannah, I'm bringing you on to the call as a panelist. You can turn on your microphone and camera.
Hello.
Hello, Hannah.
Good morning. I'm sorry, it's 7 a.m. in LA now. Let me see. Do you want me to turn on the, because I'm not like, I'm just in my PJ, so if you
You just ask your question. You can ask your question.
Okay. So yes, my question, I actually, Dr. Halli already touched upon it earlier regarding about schizophrenia and bipolar, because personally in my family, like my brother was diagnosed with schizophrenia when he was 12 or 13. And growing up, with like a brother who has schizophrenia, like it was a horrifying experiences when, he, actually he didn't, want to like physically be violent to you, but it just his brain. But now everything is better because here in the United States he stay in a long-term care. So I'm just wondering, like, is there a cure for him, or he has to be on medications for the rest of his life? And the same thing with bipolar, like, is there really a cure for it, or the patient have to be on medications and there's really no hope for them, like they don't really, they can't really fight themselves and like really be themselves, you know what I mean?
Yeah, thanks, Hannah. I'm sending you so much love because it's so hard to see a family member go through something like that. To be honest, schizophrenia is a disease where I am, still trying to find what alternative options might be able to cure it. I think there's alternative options that can really help it. But I do use medications with people with schizophrenia, often, especially if the psychosis or the delusions are causing them a lot of distress, which sounds like for your brother that was the case. But that's not to say that in addition to medications, a bunch of other things can be helpful. So just to give you an example, I have found that the kernel within the delusion, like there's always a kernel of truth within the delusion. And that might be something, once they're on medications, to really explore in therapy. So for example, if someone's quite paranoid, there might be underneath that a kind of a fear they've had all their life about people wanting to hurt them. And so once they are on medications and out of that delusion, exploring that in therapy can sometimes be helpful. Things like, exercise and diet, all of that can really be helpful. There are some studies actually on, changing the gut flora of a person with schizophrenia. So actually doing a fecal transplant. But I can't tell you right now that we're at that stage where there is, complete evidence for that. So I would say that we're still in the infancy of finding out how we can treat schizophrenia completely without medications. I would say
that is awesome.
Yeah, I would say for bipolar, there are a bit more options, and I would say strength-based approaches of encouraging creative outlets that's really effective. But for schizophrenia, I think we're still working on it.
Okay, and can I have another question?
Sure.
So for me, so that's why like I always like have the fear of, oh my God, like my brother has schizophrenia and my dad has bipolar and PTSD, and I'm 36 now, but I feel that I'm pretty healthy. So like, is there like throughout my life, like I experienced a lot, but I feel like there's a problem I've been struggling with, that like every single day when I wake up, I feel like I should have done differently. Because earlier you mentioned about follow your intuition and listen to your intuition, because a lot of times it know best. Just like you share with us, like the universe was calling you to India, and at the time, like I made the decision. It was a life-changing event for me. Like 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 getting married and things like that. So, culture, like, we have the pressure of getting married. But I just wonder, like, how can you overcome, like, the feeling of regretful that, oh, your life would have been so much different if you follow your intuitions. And I'm not sure if, like, because I have like OCD, like I'm also obsessed with the thoughts, I think about it like every day, and, like what people, was telling me that, I should have not listened to them. So also, like, in your like perspective as a psychiatrist, is there a problem with me, number one? And number two, like, how can I overcome it?
So Hannah, just talking to you, I can just, really feel your spirit of being someone that's, on the right path. It's hard for me to give medical advice, but what I will say is that there is, yes, a genetic predisposition in your case, but that's only like half the picture. And if you're able to do a bunch of these other wellness strategies that Mindvalley is so great at helping, because it's helped me too. If you're able to do those strategies, there's no reason that you will develop a bipolar or schizophrenia. But those wellness strategies are going to be much more important for you than someone that doesn't have that genetic predisposition. So things like diet for you are going to be much more important than for another person. Things like exercise, mindfulness, taking in this kind of content and not content that might be harmful for you. All of that you're gonna, unfortunately have to pay more attention to. But in some ways it might be a blessing. Like for me personally, like I said, when I went through those health problems, and even currently I'm struggling with fertility, when I go through those struggles, that's when I actually grow and do more spiritual awakening. So this might actually be a stage for you to have more of an awakening, because you are going through such a difficult time. Do you know what I mean? So these struggles are put in our life for a reason. And I think if it makes you do more of these wellness strategies in the long term, that's going to be very helpful for your life, and no reason that you would end up in the same position.
That's awesome. Thank you so much, Dr. Halli.
Thank you, Hannah.
Thank you, Hannah. Next up to the call is Vincent.
Well, first of all, thank you so much for doing what you do and what you share. I really appreciate it. I think that's all. For me, my question is, I'm curious if you have any disagreement with all these approaches that, let's say if you were to put spiritual approaches inside, things like that. I come from a psychology background, and one of my challenges when these things are brought up, they are often dismissed as placebo, it's unfalsifiable, especially if you talk about, things like energy work, these kind of emerging fields. For me, my experience has been dismissed quite a bit. It feels like there's this big polarized different world. That's my experience of it. So I'm curious, how do you manage it?
Well, that's a great question, Vincent. And, I'm just going to speak from my experience, but I felt like a lot of the reasons I was holding back was because of my own limiting beliefs about it. Yet when I actually spoke about these kind of strategies with other psychiatrists, they were more open than I actually thought they would be, and that I gave them credit for, because I think all of us in this field know that the brain is still a bit of a black box. And so if you have an option that causes no side effects, and we know our antidepressants are not that much higher than placebo, why not offer that option to your patients? So personally, I haven't had that many people kind of actually, say you shouldn't be practicing in this way. Because I had that insecurity, I would say a lot of my content, like on Instagram and stuff, is about the scientific studies that support, stuff like energy work. Because for me, it's really important that the scientific community also see there is evidence for this. But I think that might just be my insecurity, because when I bring it up with my colleagues, they're actually not as skeptical as I would have thought they would be.
Got it. Thank you.
Yeah, and I think our field has also grown a lot, Vincent. I remember, mindfulness, I don't think was part of a curriculum in the generation before me, but that was part of my curriculum now. So I think we're evolving, and people are, there's more integrative medicine, especially in the States. So we are getting to a stage where people are seeing there is some value in some of this, and it's just not like hippie anymore.
Just a quick one, I'm curious too, in terms of those scientific research and evidence, is there any sources or place you go to? You mentioned on Instagram, I'll check that out. But yeah, just curious if you know any. I'll be very curious. Those will be so supportive.
Yeah, so that's actually like, it's kind of like gold digging for me, is you know, going into PubMed and finding evidence for these kind of things. And so all of the evidence and the stuff that gets me really excited is on my Instagram. Yeah, I've actually been surprised, like things like journaling or meditation, the amount of evidence that is getting that's there already that we just don't hear about is a lot. So it's been kind of my purpose to bring that to the world.
Cool. Thank you so much.
Thank you.
Thanks a lot, Vincent. Next up is Priya. You can turn on your camera and unmute your microphone.
Hi, Dr. Halli. Hello. Nice to meet you. So very inspiring story. I've always believed that, you know, psychiatrists have to do some spiritual work on their patients in order to truly, truly help them. Just a little bit background on myself. I've kind of done a lot of spiritual work on myself to overcome some of my challenges in life. And now I feel I'm at a point I want to serve and I want to help, starting with just family members who are dealing with a lot of mental health problems. So my question is, how does one start? Like, where does one start in serving in the, you know, in the mental health space when they don't have a background? I have no medical background, but I have a lot of spiritual understanding, knowledge, and I've, you know, basically applied a lot of those practices in my own personal life and I've gotten really good results. So my question is, how does one get into serving in the mental health space without any kind of professional background? You know, so just wanted to get your thoughts on that.
Thank you so much, Priya. You know, I would say just like seeing you, you kind of emanate such a good energy that, to me, if I was seeing you as a patient, I wouldn't worry about your credentials. And I think that's, you know, a lot of, you know, the Mindvalley coaches that I have seen, you know, professionally, like gone to them for help. It's you don't look at their credentials because you just know they've done the inner work, and so they can help you as well. Where do you live, Priya?
Actually, I live in New York City.
In New York City. Okay. Yeah. So if you were in India or in Africa, I would say like there's the lay counselor programs are much more established if that was the route you wanted to take. I think we're still evolving them in the US and Canada. Like we're doing a big study right now in Canada, but they're not in place yet. So I mean, from my point of view, there are people that are always looking for people that have done the inner work, that are willing to do some coaching. And it might just be about you stepping into that space and feeling confident in it and not worrying about your credentials. And people might start coming to you because I personally am drawn to your energy. So that's an energy you're putting out there already. And Mindvalley has some programs, I think, to help with starting a coaching practice. But yeah, just know that you have it in you and that wisdom's in you and that your goal is to serve. And I think that things will come to you.
Great, appreciate it. Thank you so much. I've been looking into different coaching programs. So, but also I kind of, you know, what you said about limiting beliefs, I totally believe that. I think that I have some of my own personal inherent limiting beliefs that I need to explore a little bit more. So yeah. Yeah, but thank you. Yep, I'll start exploring a little bit more.
Thanks, Priya.
Thank you.
Thanks so much, Priya. And next up is Rupi. Rupi, you're now a panelist. You can turn on your microphone and your camera.
Hello.
Hello.
Hi. Thank you for giving me a chance to speak. I'm a psychiatrist, actually. I'm based in England, and I had a question as to where do you even get started? The culturescape within England, particularly in NHS, is very academic, very sort of evidence focused. So I've been trying to incorporate spirituality into my outpatient clinic, but I feel it can serve everybody essentially. So I think my question for you, Dr. Halli, is where do you get started?
So it's a good question. As you heard my story, I got started in a very weird way, and it just was, I was drawn to India, so that was where my start came from. But I think in terms of if I was to start now in Canada, it would be probably through doing more studies. So because, you know, you work in an academic institution, you sometimes have to create the evidence for them to believe in it. So if you're able to show even qualitative measures, like I do a mindfulness or a meditation class or an energy healing class, and people feel qualitatively better after that class than prior to that class, you have the evidence you need, right? But we do have to be kind of groundbreakers in doing those studies and getting that evidence, because no pharma company is there to back us up with the funding. And it's not, you know, it's no one really wants to do these kind of studies. But there, you know, as I look through PubMed, I'm surprised by how many people have actually done them, but they're not widely publicized. So I try and find those articles and RCTs where these studies have already been done. But then in my own practice, I'm also doing them on a daily basis and getting at least qualitative data to support, you know, my employment.
Yeah, I think within the NHS, this will be considered as out of your normal clinical realm to provide energy work or anything else that you may be familiar with. So I'm just thinking it opens the hospital to legal issues, and therefore I can almost imagine my boss is going to say, no, thank you. This is of personal interest. I don't want you to practicing this in your day-to-day work. So I think there seems to be a lot of personal and external barriers that I can foresee. And I think it's just looking past that. Maybe one option is to start building my evidence base before I approach my seniors. And finally, one last question is to think about what holistic or spiritual practices do you offer your patients at the moment?
So I always, and these are great questions, Rupi. Oh, just before I forget, there are some actually accredited integrative physician programs in the US. So we don't have much of that in Canada, but like universities like, you know, Harvard and stuff that your employers would actually really value. They do have integrative medicine options where you can become more comfortable with integrating these kind of things into your practices. So that's one option. But in terms of, sorry, what was your second question?
No, I was just wondering which holistic or spiritual practices do you offer to your patients? Yeah,
so I always start, you know, when we do our big psychiatric assessment by asking them if spirituality has any role. And if they say no, sometimes it's just very, you know, basic sleep hygiene, nutrition, diet, and then mindfulness is something I offer to everybody. But if they say yes, it really opens kind of a bigger conversation of how they connect to something higher than themselves. And so then we can get, I think, a bit more creative because they're already open to it. And they're not really the ones that are going to complain to you about you to your employers, right? I think this is something that usually, in my experience, and then if I'm worried about it, I just pray, and then they usually don't. But in my experience, you know, it's interesting. I work with some Indigenous communities. So when I started doing that work, I thought, oh, this is going to be great. I'm going to integrate so much more spirituality because that's normalized that if you work with Indigenous communities, you have to be more culturally appropriate and competent. But interestingly, a lot of them just wanted a medication from me. They were like, we get this healing from our elders and for our people. And so you have to be open to that, right? You can't push it on people. But some people do come to you ready to have these conversations, and then I'm also ready to have those conversations. We
Yeah.
also don't want that to be a closed box where you like say, oh, you go see a different healer for that. As a psychiatrist, you can also have those conversations. So I think
Yeah.
that's my practice is I really take a lot of direction from my patients.
So do you have, I'm just wondering, like somebody who does PLR, somebody who does hypnosis, somebody else who does energy work as a part of your team?
We don't right now, no. So
No.
Canada is a public healthcare system, so there's no
Same as
private
us.
options. But I recommend it. In my recommendations, I would say stuff like that. And yeah, in Vancouver, I have some contacts for like acupuncturists and that kind of thing.
Yeah.
So I would recommend them to other people, but I don't work with them personally.
I see. That's what I'm trying to do, build an integrative sort of service within my current sort of hospital and trust. And it's been quite hard to get the chief executive on board and enlarging our current sort of faith services. But no, thank you. Fantastic. And thank you for answering my questions.
Rupi, whenever you're at the frontier of something, you're going to hit some resistance. And our work is to push through that. And I really am grateful I have a colleague like you in the UK. So maybe we can collaborate on something. Please reach out.
Absolutely. I think I've sent you something on LinkedIn, but hopefully we'll connect.
Awesome.
Thank you. Bye-bye.
Thank you so much, Rupi. Next up is Amar. She's got a great question, fascinating about how mindfulness could it help reduce divorce rates? Amar?
Hi, hi, Dr. Halli. Thanks for sharing a story that was very inspiring. So me, I'm originally from India. I've been living in the US for more than 10 years now. And that my question is like, so personally, I went through a divorce, and it's been very, very surprising that I never thought I would go through. But I've been reading a lot about mindfulness, and when you touched upon how emotional intelligence and mindfulness can help anxiety, depression, and I was like more. So I'm currently like literally like trying to find people, meet the right kind of people, and what I've learned is like it's very important to find somebody who is also in the same mindset. So from my past experience, like I'm wondering, like from a concept of spirituality and psychology or psychiatry, but like opening up a little bit more to mindfulness, like how important do you think it adds to quality of a relationship, and like does it actually impact divorce rates in overall? I mean, that's a very broad question, but do you have any thoughts on that? And I would like to just see your view on that.
Thank you so much, Amar. So I would say first, my fundamental belief is that we all know what's best for us within. And sometimes my role as a psychiatrist is just to create space so that you're digging within yourself to know what's right for you. The fact that you're asking me a question about mindfulness makes me think that this is like an inner thing for you that is going to be very helpful. Because your inner self is telling you that this is something to look into. So if you've already gotten to that stage, then I would say Jon Kabat-Zinn, his teachings is how I've learned my mindfulness, has a really great program. Even if you just YouTube videos of Jon Kabat-Zinn, that's a good place to start. But if you want to get into it, there's a mindfulness-based stress reduction course that's very, like, it's really changed my life. What I would say in terms of, because I have my relationship, my husband, and I have had portions of the relationship where I was doing like really good meditation and portions where I'm not. And I would say I notice a really big difference in the way that we have conflict management during the times that I am doing mindfulness and the times that I'm not. There is a beautiful quote, I'm going to definitely butcher it, but something about that mindfulness creates a space between the stimulus and the reaction. And so that's what I found is when I am doing my daily mindfulness or meditation, if he does something that I find triggering, I'm able to first have a bit of space before I react. versus on a day that I haven't done any mindfulness or meditation, I'm reacting like this, I'm yelling, I'm going off, right? So in my personal relationship, it makes a world of difference. One other thing I will say about relationships, initially, it used to annoy me that my husband doesn't do any meditation or mindfulness. And, I used to, be kind of holier than thou about that. But to be honest, he doesn't need it. He works in music and that's a meditation for him. And the only person we can change in a relationship is ourselves. And it's been incredible how much better our relationship has been when I just work on myself and not worry about what he's doing. So that's all we can control is ourselves. So I think that those things have really helped my relationship.
So just a small follow-up on that. I think that's amazing that you bring the point that the only person you can change is yourself. But there are some relationships where you could end up with a narcissistic personality where they're only designed to, they don't know, they just suck up energy. Like how do you deal with that? Like I think that falls under the psychiatry. I don't know, that's what how do you deal with that?
Yeah, so it's interesting, Amr, you asked me this question because I have been doing therapy I received my own therapy for many years. And through therapy, I realized that narcissistic patients are a bit of a trigger for me. Yeah. And the reason they are for me personally is because I have some of those narcissistic traits. So they really, they push my buttons in a big way. But what I have found is when I do my inner work, they can still be narcissistic, but it doesn't trigger me to the same extent. So I'm able to make a very neutral decision of whether that relationship needs to continue or not. The problem is if we haven't done our inner work, then we can be projecting our own kind of insecurities onto our partner. If we've done it, we can very lovingly say, this is not the relationship for me. It sounds like you've done your inner work, so you were able to step away from that relationship. Yeah. But these are things that I think become much easier to see in terms of which direction you need to go on when you do the work yourself. That's just in my experience.
Awesome. Yeah. Thank you.
Thank you.
Great. Thanks so much, Mark. All right. So we're going to wrap up for this call. Thank you so much, Priyanka Halli, for sharing everything you did. It's a fascinating subject for many of us and one I'm very passionate about. Tell us where we can find more about you and what you're up to with your work.
So I post on Instagram and Facebook at Dr. Halli. I will be very honest. I only do it when I am feeling called to do it. I do not follow any formulas. You might not hear from me for 2 weeks. And then you'll have a lot from me. So it's very sporadic. I'm trying to not get into that rat race of Instagram posting. On that platform, I also share my own struggles. Currently, my area of growth or struggle is fertility. So I would love all of your prayers and blessings for me in that category, because I know how powerful prayer can be. But yeah, just I always try and eventually respond. So definitely reach out. I don't provide any therapy or, specific advice on these platforms because legally that's not allowed. But I'm definitely would love to hear from all of you. And it's been just such an honor to be working with you today, Ezra, and meeting you and to have heard some of your stories. So thank you so much for having me.
Yes, thank you so much for joining us as well. It was great. Thank you everyone for tuning in. This is Tribe Talks. We're going to be doing this every week or every 2 weeks. And I want you to apply to be a part of Tribe Talks as well. We feature our community members who are up to amazing things in the world, got amazing stories, or you're doing amazing work out there. I put a little link in the chat where you can apply to be a speaker. And yes, we'll be featuring more of you in the coming weeks. So look out for that. Also, I would love for you to give us some feedback on the Connections app. You can rate this call. And any feedback you like, I read all the feedback that comes in on all the events. So I would love to hear your thoughts on this call and any of the other calls that we featured as well. Thank you so much, Priyanka, and have a wonderful morning and the rest of the day. Everyone else out there in the world, have a beautiful day, morning, evening, wherever you are. Thank you so much.
Thanks, Ezra.